The potentiometer electrode is placed on the patient's spine. A ground sponge is soaked with water and placed under the patient. The test probe is fitted with the end of a cotton swab and dipped in saline. The test follows a chart of standardized test sites which correlate with specific peripheral nerves associated with specific nerve roots. Each of these sites is tested by holding the electrode steadily against the site and turning up the dial incrementally until the nerve has fired, as verified by the patient and the potentiometer. No averaging is required. The data is entered into the software for analysis and the report is automatically generated. Pain NCS is very simple to perform, but do not underestimate the importance of following these steps exactly to assure accurate readings. Although the test is painless and harmless to use for children and pregnant women, there are special considerations for patients with pacemakers. Never allow the current to pass through the chest of any patient with or without a pacemaker. Read the manual and all warnings thoroughly before performing the test. Generally, there are 6 important rules to remember while performing the test to assure patients' comfort and accuracy of the readings. Soak the ground sponge so that it is dripping wet with tap water and held firmly in place, making good contact with the patient's skin. A dry sponge will not conduct the stimulus. Dip the probe in saline for each test and touch it to a towel to prevent a loose drip on the skin being mistaken for the tickle. Hold the electrode against the skin firmly, but not hard, and anchor your hand or arm to prevent the patient from confusing a sliding probe as the stimulus. Always use the word tickle when describing the stimulus to avoid the patient reporting pain rather than a sensation. The word painless in a doctor's office is taken to mean the opposite in a patient's mind and should never be used. And most important, never lift the electrode or lower the dial to 0 during a test. It is necessary to keep the current flowing. This will become clear as we proceed. And do not use the first dial reading as a measurement. It is not an actual measurement of the nerve firing. Most of these rules exist to maintain the flow of electrical energy created by the device through the saline-dipped electrode into the patient's body and returning to the device through the thoroughly soaked ground sponge. The dial controls this energy. 0 on the dial is off and no electricity flows. Turning up the dial increases the energy. The object of the test is to find the weakest stimulus it takes to cause each nerve to fire. However, it takes a certain amount of energy to form an ion pathway and flow through the skin, like a charge building in the air to create a bolt of lightning. When the dial is turned up the first time and finally reaches the point where current flows, it fires the nerve at the same time and the patient feels the stimulus. However, this setting is typically higher than the weakest stimulus that fires the nerve, so this first reading is disregarded. Unlike lightning, where all the energy is released, the device continues to put out energy which will continue to flow at a much lower level, even below the point which fires the nerve and the patient feels the stimulus. When the dial is turned up from this point, with the ion pathway established, you can narrow in on the exact setting that fires the nerve. However, if you turn the dial too low, or if you break the circuit by lifting the electrode, this stops the flow of electricity, and you must turn up the dial again to re-establish the ion pathway first, before making an actual dial measurement again. So the rule is do not lift the electrode from the site, and do not turn the dial too close to 0. When lowering the dial during a test, keep it at a setting of about 10 or a little below. The psychological rules of the test are just as important as the physical. In order to get accurate measurements, you must have the patient's complete cooperation. Therefore, it is not only important to understand the test procedure, but what the patient may be thinking and experiencing. You cannot honestly tell the patient the test tickles unless you have experienced it for yourself, so have someone test you. Remember to use the word tickle for the sensation and do not refer to the test as painless. It is better to let the patient figure out himself that it is painless by simply saying, "This is a test we can even perform on 5-year-old kids. They just laugh because all you feel is a very slight tickle. We call it the tickle test. The object is to find the weakest stimulus that you can feel, so it is a weak tickling feeling. You really have to pay close attention and say now, the instant you feel the tickle. Memorize this and use it on every patient. It works. As you continue with the test, do not take for granted that the patient is still paying attention each time you turn up the dial. He is likely thinking of other things. You need to remind him each time to focus on the site and to say now the instant he feels the tickle. After giving the instruction, allow 3 seconds of total silence before turning up the dial. This gives the patient time to shift his attention from listening to you and to focus on the site. The test electrode is designed so that a plastic shaft of a Johnson's cotton swab trimmed near the end will fit into the gold-plated barrel. Be sure that the shaft is trimmed close enough to the end so that it fits deeply into the barrel, allowing the cotton to fit tightly against the gold plating. This assures the current will flow through the cotton after it is dipped in the saline. Current will not flow if the cotton tip is not in contact with the gold tip of the electrode. Soak the ground sponge with tap water until it is dripping wet. This assures a solid electrical ground connection. A towel placed under the patient will soak up excess water. Refer to the online manual for the correct positioning of the ground sponge for each type of test and special placement for patients with a pacemaker. The potentiometer response electrode is prepared by snapping the contact pads onto the pickup and then peeling off the protective plastic, exposing the adhesive. Lightly wipe the skin with alcohol where the electrode will be placed and allow to dry before placing the electrode. Refer to the online manual for the correct placement and repositioning of the potentiometer electrode during the cervical, thoracic, and lumbar tests. To prepare for the thoracic examination, the patient will be seated with the ground sponge under one thigh. Have the patient drop their head forward. With a marking pencil, mark the tip of the spinous process of C7, which is the most prominent spinous process at the base of the neck. C6 is the last movable segment in flexion and extension. Then palpate down and mark T1 through T12 spinous processes. The test sites are 1 inch lateral to the thoracic spinous process, starting with the left T1, followed by the right T1 through T12. After the ground sponge and response electrode has been placed, power up the unit. Be sure that the 250 Hz A delta yellow light is on. Also, power up the potentiometer using the switch on the side of the unit. Be aware if there is any scar tissue at the test site. If so, move a little bit proximal to it and match the same spot on the opposite side. Note that even in completely normal patients, certain sites require more or less stimulus to fire the nerve. The software takes this into consideration, which will be explained later. The cervical T1 and T2 test sites typically require less voltage to fire and are in a particularly sensitive area on the patient. For the patient's comfort, be aware of these more sensitive sites and do not turn up the dial too far, too quickly. Also, be sure the dial is turned all the way down to 0 before touching the electrode to the patient.